Hello, Uganda. My name is Mwanguzi Shadrack, your doctor from Health Touch Uganda. Today I'm going to be talking about some of those things that you're supposed to do to help someone who has sustained a fracture. Fracture, I mean someone's bone has been broken. This is someone who sustains an injury. Maybe they've been involved in a traffic accident or in a form of traumatic event, and before you know, they are not able to use one of their legs, one of their arms. They are swelling up, there is associated bleeding. Some of those things are supposed to communicate to you that maybe this person has sustained a fracture, and you should now know what to do. Number one, I'll start by saying the most important thing for you to know is this person is supposed to end up in a health facility, not in someone's backyard, not at the neighborhood. No, it is the person is supposed to receive ultimate medical attention in a health facility. Otherwise, there are many other complications which can come from any other form of treatment modality, and death and permanent deformity may result. So number one, when you come across this person, the fracture may be obvious. For example, the bone is protruding out of the skin, and in that case usually they are bleeding as well, and in a situation like this you want to attend to the bleeding first. So if you can find a piece of clean cloth, if you can find bandage, and you tie, you apply pressure and ensure the bleeding doesn't continue. The next thing will be trying to minimize movement of that particular part of the body. So you can tie it with a piece of bandage, and usually it's better to use something that's straight. You put it on the side. For example, if I have broken my hand, you put something straight here and you tie it on the broken part of the body. Don't try to fix the bone, don't try to straighten it, don't try to push the protruding part back into the skin. Don't try to manipulate the wound. Just find something straight, attach it and tie it over the broken part of the body. If you don't have any at that particular time, you can use, if it's a leg or if it's a hand, you can use the other unaffected part of the body to immobilize the other part. For example, if the fracture is here or if the broken part is here, I can use this other hand and I wrap them around so that this unaffected one can work as the tool for immobilizing the other one. You can do the same thing for the legs, but if you can find something, please use that. Try to ensure the person doesn't over move. But if you realize the person is breathing very fast and the breaths are shallow, you realize they are not responding, you realize they seem to be confused, they have lost a lot of blood, it's better to make them lie down, and if possible you can raise or elevate their legs. And when they are lying down, if possible, this other part of the body is supposed to be higher, slightly higher than the head. Why? Because sometimes they've lost a lot of blood, they are going into a situation we call shock, which comes about when someone doesn't have enough blood reaching to the different parts of the body, and the head in that situation is prioritized, and you want it to receive a lot of blood even from this little blood remaining. When the person is not responding, the person is in a lot of pain, you've lost a lot of blood, please try as much as possible to get them to a health facility as soon as possible. In as much as every other person that has sustained a fracture needs to get to a health facility, these other ones need even to get there without any delays. So there are some of the things that you can do to help someone that has sustained a fracture. Mwanguzi Shadrack, Health Touch Uganda, follow the light.